Welcome back to the Nursing Post podcast, All Nursing All the Time with Ashley Moore and Rosa Horsley. In this episode, we discuss prostate cancer, and prostate cancer treatments. Our goal is always to inform and to start conversation.
So we're going to start this episode off with some statistics just to kind of give a baseline. These are from the American Cancer Society. Other than skin cancer, prostate cancer is the most common cancer in American men. The American Cancer Society estimates for prostate cancer in 2020 year that there will be about 248,530 new cases and about 34,130 deaths from prostate cancer. About 1 in 8 men will be diagnosed with prostate cancer during their lifetime, and prostate cancer is more likely to develop in older men and in non-Hispanic Black men. About 6 cases in 10 are diagnosed in men who are 65 and older, and it is rare to see it in men under 40. And the average age of diagnosis is about 66. Prostate cancer is the second leading cause of cancer death in American men, only behind lung cancer. About 1 in 41 will die from prostate cancer, which is staggering to me.
Absolutely.
And in 3.1 million men in the United States who have been diagnosed with prostate cancer in their lifetime are actually still alive today. Kind of high numbers for something that is there's a lot of preventative maintenance for, in my opinion.
No, and I agree with that. The former urology nurse in me, I have seen a lot of biopsies, treatments, PSAs, labs, all of that stuff. But one of the things that, and one of the reasons why, we're wanting to do this is to kind of like take the stigmatism out of men having their annual exams, whether it be wellness, physical, and or rectal exams, because that last statistics, 3.1 million men in the United States who have been diagnosed with prostate cancer at some point are still alive today, is an important number, because usually we only hear about the bad. When you hear cancer, you hear the stigmatism, and people still to this day automatically associate cancer with death. And so it's very important for us as nurses to let people know that preventative medicine exists, because if it didn't, these 3.1 million men still wouldn't be alive today. And I think that's a very important fact to put out there. I used to tell my daughter all the time when she was little that she needed to eat her tomatoes because, they were good for her prostate. My daughter had no idea what a prostate was, but I got her to eat her tomatoes.
Mm-hmm.
A lot of people don't know what a prostate is the point I'm trying to make. And my daughter didn't figure it out for a little while until she looked up what prostate was and came back to tell me she didn't have one. 101 of prostate, women do not have them, only men. So shame on me for getting my daughter to eat her tomatoes. The prostate is a small and rubbery gland. It's about the size of a ping pong. Some even will compare it to the size of a walnut. Mm-hmm. And it's located deep inside the groin between the base of the penis and the rectum. And it sits below the bladder and wraps around the urethra. The prostate is part of the male reproductive system. And a lot of people don't realize that. And, the male reproductive system includes the penis, the prostate, the seminal vesicles, and the testicles. Mm-hmm. And it's the prostate's job to support part of the seminal fluid, which is semen. Mm-hmm. And that mixes with the sperm from the testes, and it helps the sperm to travel and survive, in order to make babies. You don't need a prostate to live, but you do need it to reproduce. Prostate cancer is a disease in which cells of the prostate grow out of control. So that's basically what cancer is anyway, right? Yeah. It doesn't matter exactly, where it is. It can be on the skin, ovary, cervix, prostate, but it's basically the rapid growth of cells, and they just keep rapidly growing out of control. Excluding skin cancer, prostate cancer is the most common cancer in American men, which is one of the statistics that Ashley had mentioned earlier.
So there are some risk factors that will make you more prone to having prostate cancer. Of course, being male, since they only have a prostate, women do not have to worry about getting prostate cancer. Being African American, they get their prostate cancer at a younger age. They tend to have more advanced disease when it's found and tend to have more severe type of prostate cancer than other men. And then having a family history of prostate cancer also increases your risk. There are some signs and symptoms for our males to worry about or for our females to know so that way we can educate the men in our life.
Who never want to go to the doctor. Sometimes we have to give them that nudge and shove out the door.
Absolutely. It is important to know some men do not have symptoms at all. But if you do have these symptoms, you really should see your primary care, and they'll probably get you to a urologist. Difficulty with starting urination, a weak or interrupted flow of your urine, frequent urination, especially at night, difficult emptying the bladder completely, pain or burning when urinating, blood in urine or blood in semen, pain in the back, hips, or pelvis that does not go away, or pain with ejaculation. Those are all things that should be red flags. And if men are going to go to the doctor for anything, I would think that area would be the one thing that would be like Batman signal, you know,
Whole light. Yeah,
yes, I'm
absolutely.
coming, I need help. It's a serious stuff.
I can see one passing out now of blood in the semen.
Oh, yeah.
I can see a man toppling over now.
It's just seeing be like, something's in
Yeah,
that.
something ain't right. And then they hit the floor, bless their hearts. Being the former urology nurse that I am, I've seen a lot. And I do have sympathy for men. Usually I don't, but working in urology, it kind of softened my heart up a lot because, they do have like issues with kidney stones. And, that's really like the only time I feel really, really bad because I compare that to for them, like, as childbirth for women. So any man in my book that's had a kidney stone has given birth and they have the right to name it. I'm just saying, you earned
As
that
long as they
right.
catch it in their little screen.
Yeah, that's right. This is one of the other areas where I feel sympathetic. There's such a bad stigmatism and cognition when we're talking about the prostate and having these exams done. The screening is so simple, but yet, you hear a bunch of men get together and talk about it, and they're like, no, I'm not having anybody, do that to me, or,
Mhm.
I've also heard them, unfortunately, it's out of ignorance, equate having this exam done to being gay or homosexual. And it has
Mhm.
nothing to do with that. This
No.
has to do, with the health of your prostate and the fact that we're trying to save your life. I can assure you that the physician has no pleasure, just like you have no pleasure in this exam. We just need to take that stigmatism away from it and let people know, especially men, know that this is extremely important. Every year, or as directed by your physician, a man should have a digital rectal exam
Mhm.
and a prostate specific antigen test. These tests help early diagnosis of prostate cancer. And during a DRE, the physician uses a glove and lubricates his finger and inserts that finger into the rectum to feel the prostate for anything abnormal, such as cancer. They're looking for size, they're looking for polyps, they're looking for anything that's not the
Weird growth.
usual.
Yeah, absolutely.
According to the CDC, the PSA, which is the prostate specific antigen, is a blood test. And what it does is it measures the level of prostate specific antigen in the blood. And the PSA in the blood can be higher in men who have prostate cancer. So the rule of thumb is the higher the PSA level in the blood, the more likely a prostate problem is present. This is where I have to like kind of put my side note in. There are a lot of reasons why a PSA can be elevated.
Mm-hmm.
If you have prostatitis, which is, inflammation of the prostate, that can make your number rise. If you had a procedure done that involved your prostate in any way, like maybe you have to self-catheterize, maybe you recently had an exam, or you had a procedure and your physician draws, at your PCP an annual PSA because they're trying to keep track of it too. Sometimes that can come back elevated, especially if they don't realize or know that you've had some manipulation to your prostate done. And sometimes just infection of the prostate happens, and that can elevate your PSA. So just because you have an elevated PSA doesn't automatically correlate to having cancer.
I think that's
So
important because a lot of men do have elevated PSAs.
absolutely, but it doesn't mean that you have cancer. It's just one type.
It's one tool.
One screening tool in the toolbox to help, you know what I'm saying?
Yes.
To kind of diagnose and determine. So sometimes the PSA level, like I said, could be, elevated for other reasons: enlarged prostate, an infection of your prostate. Maybe you're taking certain medications, and that's made your PSA go up, or certain procedures. Diagnosis of prostate cancer is generally made by having a prostate biopsy. And when I worked in urology, we were an outpatient procedure type of a place, so we did a lot of these in-house. And this procedure is used to remove small pieces of tissue and or cells from the prostate so it can be examined under a microscope. There are 3 ways to perform this biopsy, but the transrectal method, which is done through the rectum, is the most common, and that is definitely one of the preferred methods when I was working in urology. This is done using an ultrasound used to look at the prostate gland and to guide the biopsy needle. Of course, with every single procedure, there's always risks. And so some of those risks include bruising and discomfort at the biopsy site, an increased amount of blood in your urine or stool, having belly or pelvic pain, having troubles urinating, changes in the way your urine looks or smells, or burning with urination, because that might be a sign of infection. And of course, you definitely want to seek medical treatment if you're having fevers or chills.
So I found it really interesting in the research that I did with so many cancers. It's, there's a problem, you go to the doctor, you find something, you get a biopsy, it gets diagnosed, you get your stage in, there's a treatment plan. It's very structured. It is not that way with prostate cancer.
It's definitely not cookie cutter.
There's a lot of variability from what I researched in what the patient has going on, their age, what their numbers look like. It's just not, okay, you have prostate cancer, so now here's the next thing. Like some of them don't even send them to oncology until they hit certain levels or there are certain situations. It's not like, oh, you have breast cancer, here's your diagnosis, go see an oncologist. It's not that way at all. And so I found that very interesting that there are a lot more variables with this type of cancer than I've seen with a lot of others.
One of the things when I was working, well, there's a lot of things that I learned while I was working in urology about the prostate. One, it isn't cookie cutter. Like what works for one may not work for other, but there's so many types of treatment. And I did not see a lot of cases that we referred to the oncology portion of the hospital, unless, we started talking about radiation therapies and chemotherapies. Up until that point, a lot of things stayed pretty much, I'd hate to say in-house, because first, we're really conservative with it. We're trying to be as conservative as we can. So, they're going to make sure that they're checking those PSA labs. Maybe you only had to get it once a year, but since it's elevated, they're needing to check it, every 3 months, every
Mhm.
6 months. They're going to give you options for surgery because you can live without a spleen, you can live without a gallbladder, you can live without a prostate.
Mhm.
Um, is that ideal for men? Probably not, because of course, with not having a prostate, there are other medical issues that arise, but you can survive. You know what I mean?
Yes.
You can live without having it. Radiation therapy and cryotherapy, they're all used, but those aren't usually what's considered first line in treatment.
Mhm.
Usually those hormone therapies are first line treatments. I remember giving so many Lupron depot shots, and they have so many different strengths. They have so many different kinds. You had some that would be monthly, some that were every 3 months, some that were every 6 months, and some that were yearly. And it just really depended on, that of the patient, what the target was, what the mutual, because it's much patient and doctor. There, you guys have to be on the same page with it. And like I said, not everything always works for one person. Some people can't take those Lupron depot shots. They come
Right.
with a lot of side effects. They come, with night sweats, almost menopausal
Menopause kind of symptoms.
symptoms.
Yeah.
Men have to go through that when they're on these depot shots. And a lot
Mhm.
of times men can't handle that. There's also chemotherapy, immunotherapy, there's targeted therapy. When they place these little radioactive beads into like certain parts of your prostate and then
Mhm.
have you go through radiation, hoping to shrink it, and then have you go through chemotherapy. They also have treatments for cancers of the prostate that have metastasized. And
Mhm.
definitely by that point, you have your oncology, radiology oncology, on
Your
board.
team, yeah.
Yeah.
Do you think that working within urology that a lot of men don't want treatment because of the fear of impotence?
That unfortunately is one of the side effects if you do have your prostate removed. It's there's so many prostate issues that we haven't even touched. We're just trying to bring awareness to prostate
Right.
cancer. There's so many issues. Even if we just wanted to speak about an enlarged prostate, that would be a whole episode all in of
Mhm.
itself, because a lot of people don't realize when you have an enlarged prostate, it causes other issues. It cuts off, your urethra, your ability to urinate. It squishes that tube, and then it makes it uncomfortable for a lot of men when they can't empty their bladders. Two, it can be painful when they urinate. There's a lot of hesitancy there. But I think it's important that all of it's mentioned, not just cancer, because there are things that lead up to it. And
Right.
I think the more you know about your body and the more that you educate yourself, the better off you will be. Each stage of prostate cancer requires, different treatment or maybe a combination of
Mhm.
treatments. Like I said, it's not cookie cutter
No.
uh, at all.
And I found that to be very interesting in my readings, just the fact that there was no set algorithm, and in medicine, you really like algorithms, like, if this
Hmm.
happens, do X. If this happens, it's very, a lot of medicine, I know there's a lot of gray, but there's also a lot of structure.
Hmm.
Um, if this comes back here, this is what we're doing. If this comes back here, then we're doing that. And they try to account for all that gray area. And then with doing the research for this, I was like, holy cow, it's like, oh, well, hold on. You don't have a history, you don't have this, and you don't have that. So we're just going to monitor you, but you have a large family history and you're African
Hmm.
American.
So they have
So
to be more aggressive.
we're going to be doing something completely
Yeah.
different with you. And so it is interesting to see that, but it's also kind of nice because I think that that's where we need to get in general with medicine, where we're doing much more individualized care and not try to make everything about the numbers. I think when we try to make too many things about that's our protocol, what happens is we miss that human element.
Absolutely. Somebody's going to fall through the cracks if you consistently streamline everything.
Yeah.
Like somebody's going to get missed, something's going to get missed. And I
Mhm.
would hate I would hate for men in general to put off treatment because, one, they have a fear of being told they have prostate cancer when it's something that, one, can be detected early,
Mhm.
and two, is so treatable.
Right.
But
There are other options besides removal of the prostate.
exactly. But you have to take the initiative as a male to make sure that you're doing your part and that you're going to the doctor and that
Mhm.
you're asking for the exams that you're asking for. And that when you hit the age of 40, you're asking. I think maybe it's time for me to see a urologist just because I want to make sure everything's clear. You know what I mean?
Well, yeah,
Do your
absolutely.
due diligence so that, you don't have to be one of the unfortunates that is caught too late and you're pretty much your options are limited.
Well, and I'm a big believer in if you don't mind, the provider doesn't mind either.
Yeah, I
And
mean, I'm not trying to be funny. Once, as nurses, once you've seen one, you've kind of seen them all. It really is true.
it's
People
it
don't think it, but it really is true.
it really is. Like we don't I mean, I do EKGs all day long. The amount of women that don't wear bras is astonishing. It really is.
Doesn't surprise you, though, does it? Because
But I'm
literally
like,
one, you've seen them all.
I'm,
That's how I felt working in urology. You know how much this sounds so bad what I'm going to say right now. You know how many vaginas and penises I've seen in my lifetime? Way too many that I would want to, but I tell you what, they all after a while look the same. You cannot remember whose vagina looks like goes on what person's head because you've seen so many of them, and that goes to the same in the male with males
yes,
too. So if you have like this complex or I can't go because I don't want somebody to see this or do that, like I'm telling you,
we've seen
you're
it.
probably like not even memorable in that area or in that regard to your medical care provider because once you've seen one, you've seen them all.
Yeah, it's so funny. It's the one thing men don't want to hear. We are not going to remember what your penis looks like. We do not care. It is
But
not that
in
memorable.
this case, it may make them feel better going to the doctor to be seen. Now, that's not something that I would say to my husband because that wouldn't fly over well. However, just for general information, nurses really aren't taking that hard of a look. So please go get checked out.
Yeah, exactly, exactly. If prostate cancer is found only in the prostate, it is localized. This is also referred to as stage one. It's just in the one area. If it spread to the different parts of the body, the stage is regional or distant. For prostate cancer, 74.3% are diagnosed at the local stage. The 5-year relative survival for localized prostate is 100%.
Can you reread that for me, Ashley?
So, if your prostate cancer is located only in the prostate, it is localized, and the 5-year relative survival for localized prostate cancer is 100%.
Amazing.
You may die of a car wreck, but it won't be because of your prostate cancer.
Amazing.
The reason this fact is so important is because with everything in medicine that Rosa and I preach, it is all prevention. Your routine checkups can literally make the difference between life and death.
Please make that appointment with your PCP and please make sure that you are doing your due diligence and asking for your DRE and PSA exams.
You can find our references from today's show on our website, thenursingpostpodcast.com. And please subscribe to our podcast. We would appreciate that. We love to hear your thoughts or your comments, so you can leave them on any of our social media platforms. And thank you again for listening to the Nursing Post Podcast.